Namaste, this is Dr. Kalpana Shringar from Prakruthi Charitable Foundation. I'm the clinical director, and we started Prakruthi in the year 2008. My husband and I started this with the hope to help the mentally sick people and the psychologically disturbed. So, first of all, I should thank my in laws who had started Indra Health Home, which ran for nearly 40 years under the same roof. And my father and mother, they insisted that we start something for the mentally sick people. So I started this NGO in 2008. And many people have been helped in this NGO. We have helped very, very poor people, and our charges are very, very minimal. And we train these people, whoever is psychologically disturbed, we get them, we treat them, we rehabilitate them, we give them skills training, and we treat them with a lot of love and affection and see that they come out of this major problem. The thing is, post COVID, there has been a lot of problem, and each family probably has one or two patients, either with anxiety, fear, depression, OCD, and so many things. And we have a lot of clientele who come here with a hope that they are going to improve. And we take it as a pride and to help these people, and we see that they get well and they stand on their own feet. Many people have been rehabilitated in our institute, and we have given them jobs. We pay them a salary from our pockets and we send them. To be very honest, we have had no funding so far, but we have done all the best. Only our trustees have been really very, very efficient, and they have helped us, and they have taken it as a challenge to help these mentally sick people. We, on an average, treat about 2,000 patients, close to 2,000 patients a year. And people come from all walks of life. They come here, they get rehabilitated. They because it's just a daycare unit, they have to come in the morning and leave in the evening. And during the period when they are here, we teach them a lot of skills. Some people come from the old city areas, some women who are not allowed to work outside. So we teach them some things like stitching, embroidery, mehndi designing. So they learn that and they start earning. There are some people who are very, very interested in cooking. They learn cooking. And some people are interested in organic farming and kitchen gardens. So we train them in that. We get people, we have a lot of volunteers. We have hundreds of volunteers who come here and they help these people. There are so many people who have learned jewelry making. They have learned drawing and painting. They've done beautiful mandalas. And there are so many things that they've learned in this institute. And we have preserved so many of them with the hope that we can have an exhibition wherein we can sell those products and then, help some more mental patients who really need help. Many a times what happens is mental patients are just thrown outside the house because the relatives can't afford getting them treated, and moreover, it becomes very difficult to manage a mental patient. For people like us who have been having a lot of experience and who are exposed to so many patients, we have no problem in treating these people and bringing them on the track. So we try to do it, and we have so much of persistence that we don't leave them unless and until they get well. We talk to their families, we give them psychoeducation, we talk to the patients, and we, supposing other people, they come with some breakup and all that, they go into depression, we call the spouse and we talk to them. So marital therapy is given, individual psychotherapy is given, grief counseling is given, and things like PTSD, they are taken care of. Patients with schizophrenia, we have seen a lot of cases with schizophrenia, with bipolar disorder, OCD, anxieties, phobias, you name it, they are here in the clinic. So all these patients are brought back to a normal level of functionality, which is very, very essential in our profession, and we send them back home. Apart from this, we have taken another very challenging job of training people, especially post COVID, when there were so many patients with psychological disorders. We felt the need for having many more people who undergo good training in our charitable foundation. So they come here for internship, especially from places like IGNO, Dr. Ambedkar University. There are some students who come from Villa Marie, St. Francis, St. Anne's, and all that. They undergo training here, and we give them very good training and teach them the clinical aspects. We teach them how to help people in rehabilitation. We make them sit with us when we are seeing cases, especially those who have improved and who are about to leave. So, good training is given to these people, and we send them back. So, we do a lot of work for the psychologically disturbed. We also have different therapies which we have lately introduced, like music therapy, art therapy, gratitude therapy. We have all these things so that people develop a kind of resilience and emotional stability, and they can become very, very functional. Even schizophrenics, who have been considered as, people who will never get well again, they have become so very functional. Some of them are earning, some of them work in my institution. So my husband and I, Dr. Uday Shankar, and me, we take care of all these things here, and we help a lot of patients, and we hope to help many more. So our doors are open for all of you to come if you come across any person who is suffering from these problems, and we are always available to help you. Thank you so much.